Hello. Asthma is a breathing condition that is very common, affecting more than 5 million people in the United Kingdom. Asthma often runs in families and is found more commonly in people who have other allergies or hay fever. When we take a breath in, air travels through our mouth, down our windpipe and into the smaller airways in our lungs. Every breath we take is important for delivering essential oxygen to and removing waste carbon dioxide from our blood. People with asthma have very sensitive airways. They become inflamed and narrowed when they come into contact with irritating substances, known as asthma triggers. The muscles around the airways tighten. The lining of the airways starts to swell, and lots of sticky mucus is produced which blocks the airways. If the airways are only slightly narrowed, then you only get mild symptoms. But if the airways become so restricted that you cannot get enough oxygen into your lungs, this is a severe asthma attack. It is a medical emergency. If you have asthma, your symptoms tend to come and go. They are often worse at night or first thing in the morning. Asthma symptoms are usually made worse when you come into contact with a trigger. Common asthma triggers include getting an infection in the airways, pollen, animal fur, smoke, chemicals or dust, air pollution and cold air. Physical activity can also act as a trigger. Asthma commonly causes chest tightness, coughing, wheezing and breathlessness. Your GP may suspect asthma based on your symptoms, personal history of allergies and your family history. They will arrange breathing tests to confirm the diagnosis. This involves breathing into a tube and can often be done at the GP surgery. Sometimes you may need to be seen in the hospital for further tests to help rule out other conditions. If you have asthma, you should avoid triggers, maintain a healthy weight and quit smoking. Asthma is usually treated with inhalers. Inhalers deliver medication directly into your airways to help open up your airways and reduce the inflammation. You will normally have an inhaler that relieves symptoms and one that prevents symptoms occurring. It is important that your asthma is controlled so you do not require your reliever inhaler frequently. If you are using your reliever inhaler daily, then you are vulnerable to complications. If your asthma is not well controlled, then you may need to see a hospital specialist, where treatments other than inhalers will be considered. If you have any questions about asthma, please speak to your GP or practice nurse.